This is a video on lateral knee x-rays and in particular a specific example of a positioning technique. This video is intended for student or graduate radiographers who do not have a specific technique themselves. I have found this method works the majority of the time and gives great diagnostic x-rays. The aim of this video is to make sure you are aware of how important it is to perform the lateral knee x-ray correctly and how this can be achieved. The objectives of this video will be that you will understand why a lateral knee x-ray is performed, what are the limitations to assessing a lateral knee x-ray if it is not performed correctly, and you'll be able to demonstrate how a lateral knee x-ray can be performed by the position shown. The reasons why a knee x-ray will be performed include the Ottawa rules, which state that a knee radiograph is only required for patients with knee injuries with any of the following. Their age is 55 years or over, they have isolated tenderness of the patella, tenderness at the head of the fibula, the inability to flex to 90 degrees, or an inability to weight bear. Other reasons include known osteoarthritis, and if the patient is for a knee replacement, they will have pre and post knee x-rays. Trauma is another indication, however, we will not cover this as the positioning demonstrated should not be used in the trauma setting, as a horizontal beam method should be used to assess fluid levels in the fat pads. Now we will take a look at the anatomy of a lateral knee x-ray. First you can see we have the articular patellar surface, the patella itself, tibial plateau, the tibia, the fibula, the tibial condyles, the intercondylar tubercle, the medial and lateral femoral condyles superimposed, and the adductor tubercle. Now see if you can have a go at labelling the anatomy. To assess a lateral knee x-ray, there are a couple of things we need to look at. We need to ensure that the posterior aspects of the femoral condyles are superimposed, that there is demonstration of the patellofemoral joint, a demonstration of the joint space between the femoral condyles and the tibia, and the knee should be flexed no greater than 30 degrees. This allows for the lines and angles that surgeons use to assess and plan for surgery. We can see in this video how much a small rotation in the ankle or hip has on the condyles of the knee, and how this will affect the x-ray. This shows the correct positioning of the bones of a phantom for a lateral knee x-ray. Now we will have a look at the equipment we will need for the examination. We will need an x-ray bed, an x-ray tube, an x-ray reader to read the cassette, and a console to view the images. We will need a 24 by 30 cassette and 2 sponges, a 45 degree and a wedge. This is an example of the basic position without a patient. Now I will demonstrate how to perform this technique. Bring the patient into the room and ask them their name, date of birth, and what they are having x-rayed. Get them to lie on the table and expose the leg that we are x-raying. We would then perform the AP projection and move on to the lateral. Get the 45 degree sponge, as seen here, and ask the patient to roll onto their right side, the affected side, and put their opposite leg over and onto the sponge shown here. Now get the wedge sponge and pop this under their ankle, placed in this position. Next, get the cassette and place this under the knee. It should look like this. You then need to assess the tibia and ensure that it is parallel to the table. If you need to, move the sponge in or out so the angle of the ankle is more or less. You then need to look at the patella. Ensure that you can fit 2 fingers between the cassette and the patella. If you have more or less, roll the patient's hip back or forward to bring the patella up or down. You then need to align the tube and put a 5-degree caudal angle on the tube and center the tube over the patient's knee. The final step is to place your side marker on the cassette. The final position should look like this. Pause the video here and see if you can work out the points to remember. Here they are. The opposite leg needs to be over the top. There needs to be 30 degrees of flexion of the affected side. You need to ensure that the tibia is parallel to the table and use a sponge to prop the ankle up. Ensure that 2 fingers fit beneath the patella. A summary of what we have learned. We've learnt the reasons why we perform a knee x-ray. We've learnt the anatomy of a lateral knee x-ray. We've learnt how to assess a lateral knee x-ray and why it's important. And we've also learnt the demonstration of a lateral knee x-ray position. Thank you for listening. I hope you've learned something. Thank you also to Olivia for being a model for this demonstration.